Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a February 22nd, 2021 update from the Dubuque County Public Health Incident Management Team. Dubuque County's COVID-19 new case trend line is trending downward, with 253 cases reported in the last 14 days, which is a slight increase from the last 14-day period I reported last week. Iowa has detected 10 B117 variants through sampling at the State Hygienic Lab, and that's 2 more than last week. And nationally, 44 states report a total of 1,661 B117 cases, along with 27 of the 2 other variants. 2 weeks ago, the B117 variant was doubling every 10 days in the U.S. Preliminary data from the UK suggests that the B117 variant is more transmissible than previous variants of SARS-CoV-2, and preliminary data suggests the possibility that it can also have increased severity of disease with infection. I'm reminding you of this because the variant will continue to infect people and increase the number of cases unless we do our part to limit community spread. Another thing to remember is that as community spread continues, the chances increase of more variants emerging that the vaccine may not be effective against. Right now, the vaccines are effective against B117, but with just only 9,100 Dubuque County residents having received their first dose of vaccine and 5,700 completing both doses, we can't rely on vaccinated people or the 12,200 individuals who have immunity through having COVID-19 disease to slow the spread. That's only up about 18% of Dubuque County's population, which is way short of the 70% we need for herd immunity. Speaking of reducing community spread, last week the CDC reported on research they've been doing about the effectiveness of masks. Their experiments revealed that a medical procedure mask alone blocked 56% of the particles from a simulated cough, and a cloth mask alone blocked 51%. But the combination of the cloth mask covering the medical procedure mask, or double mask, blocked 85% of the cough particles. The CDC reports that double masking reduces the virus emitted from a positive COVID case and also the amount of virus exposure a person would receive. The main thing to remember about masks is fit and filtration. Double masking, knotting, and tucking can all make masks work better. But make sure your masks aren't too thick or have too many layers that you can't breathe. And most of all, make sure you're wearing them consistently and correctly, not like the 25% of people who wear masks under their nose. The incident management team continues to coordinate local vaccine distribution and administration. Just to remind everyone on how to get a vaccine, and right now, as we finish teachers, school staff, and child care providers, we are still focusing on those 65 years and older. So, for those 65 years and older, watch Hy-Vee and other pharmacies' websites to see their vaccine available, or wait for your healthcare provider to call you with an appointment. Or if you don't have a healthcare provider, call the Vaccine Sleeves Up phone number at 563-587-4950. You'll be asked to leave your contact information, and then you will be contacted when a vaccine becomes available. For everyone younger than age 65, you will be contacted by your employer if you meet the criteria of one of the priority groups. Scheduling will then happen as vaccine becomes available, which will take months. If you're under 65 and think you're in one of the priority groups but do not work for an employer, you can also leave your information through the Vaccine Sleeves Up phone line at 563-587-4950. As we start out this final week of February, which is supposed to be a short month, but it seems to have lasted forever, we can celebrate more daylight and slowly warming temperatures. It's important to have positive feelings that release good endorphins. We could all use a mood lift. Exercise and physical activity will also lift your mood, and we all need as much of that as we can get because, in case you didn't know, well, we're all in this together, the rest of life besides COVID still keeps on happening.